how do we provide more services and how do we get fairly reimbursed for the services we provide. I think prior to COVID, your garden variety long-term care pharmacy was in a more supplier relationship with nursing homes, that we buy the vaccine, we ship it to you, you store it and vaccinate your people, on your own at the nursing home. What COVID taught us was that in that particular emergency, the nursing homes came to us and said, hey, we can't do it. You guys have to do it. So I felt like that was a profound opportunity for pharmacy. Our community pharmacists had already been vaccinating and doing it in the community settings. This pulled long-term care pharmacy into the responsibility for vaccination. And coming out of it, you now have the opportunity as a pharmacy. If you participated during COVID, you became a Medicare provider as a pharmacy. You got all of your pharmacists or some of your pharmacists and staff as certified immunizers. And we come out of it in a period where you've got a recommendation for a high-dose flu vaccine, which is a $130 vaccine. You've got the COVID vaccine annually, which is a $130 vaccine. You've got RSV, which is, I think, a $250 or $300 vaccine. And you have all the other ASCP recommended older adult vaccines, things for shingles, that are all, and I don't mean to frame this as revenue opportunities, but that's exactly what they are.
Yeah. It's outcomes plus the appropriate amount of revenue is kind of what everybody's asking for, I think, from that perspective.
You're getting the opportunity to do what you always do and, purchase wisely and make a little bit of money on the product. You're also getting the opportunity to get reimbursed for the administrative act of applying the vaccine. You have a lot of flexibilities in that. So if I'm a pharmacy, a long-term care pharmacy, and I'm responsible for the vaccine at the nursing home, I can send my people in to do it, like on a clinic day. I can bill for that. I can contract with a third party that might meet the vaccine at the facility and provide the vaccines. If I'm really capable, I might time my vaccines to arrive at the facility when my consultant pharmacist is there and they can provide the vaccines. And then finally, I can contract with that nursing home for the nurses to be the last mile of the vaccine process. And I can bill for the vaccine and the administration and then reimburse the nursing facility nurse for doing the injection and reporting the information back to the pharmacy. There's a lot of value in that. There's value in it from the perspective of pharmacies having an opportunity to create a revenue stream where they didn't have one necessarily before. And two, it does a lot for public health because now we've got a full circle of the vaccine getting ordered, patient-specific, going to the facility, being administered, getting that information back from the facility, reporting it into the state immunization information system, and now you've got sort of a wraparound procedure that lends itself to better healthcare.